Step in our research was the industry overview. The industry overview is a full-scale look into the healthcare industry. Some factors that we measured. We measured market size, geographic scope, market growth rate, industry life cycle, degree of vertical integration, pace of technological change, ultimate consumer needs and wants, and product differentiation. We believe these to be the most important factors when evaluating the industry that our company is in. Start with market size. The U.S. healthcare industry is currently worth around $808 billion, while the global healthcare system is close to $12 trillion. With an annual growth rate of 7.3% per year since 2014, and there is also 20 million employees and over 900,000 businesses as of 2018 in the U.S. healthcare sector alone. It is a very large industry, as we found in our research, and it is only going to get larger. With geographic scope, however, it plays a large part in healthcare. It's very much related. Where we are, where we were born, and where we live affects how we live our lives and how our health is, and the access to healthcare. And this is something that companies in the industry are very focused on moving forward, as it is a large business opportunity to strategically place themselves in geographic areas where not many other healthcare businesses would place themselves. Market growth rate. The industry in the United States has grown throughout the past decade, is only looking to increase as well. And due to some factors, such as age demographic, and the demand for healthcare is only increasing. There's forecasts that believe that the industry will continue to grow at the rate that it has already grown at for the last decade. And with the advancements in technology and science as well, there's strong evidence to believe that the healthcare industry will only keep growing. Industry life cycle. Most of the industry is currently based on innovations in technology and science. Many innovations in those fields have been made within the past 5 years and has caused groundbreaking growth in the industry. One thing that does need to be handled, though, with industry life cycle is the disposal of medical equipment and apparatus is very important moving forward, as the healthcare industry currently accounts for a large amount of the pollution that is currently affecting the environment. Degree of vertical integration. Some companies have attempted a degree of integration when it comes to acquiring multiple companies and offices to better improve their market share in the healthcare industry. It remains a question whether or not this is ethical, as many people see it as a way of handcuffing healthcare, which is not a good thing, as it limits the choice for the average consumer as to where they receive their healthcare and how their healthcare is managed. Diversified options are a safe practice when it comes to healthcare. This is a better way, in our opinion, for healthcare industry companies and CVS Health to better integrate itself in the industry. Pace of technological change. Technology is rapidly evolving in the healthcare field. Every year, new advancements that are state-of-the-art that replace technology that could have been invented just years prior. So there is a large amount of turnover in this area. These technologies have been proven to be insanely beneficial, but can also be very hard to implement and costly, as there are large learning curves when it comes to the softwares in these innovations, and the training that would be required and the time that is required for that training can be very costly and can also be very inefficient for the companies that are acquiring this tech. Product differentiation. Currently, healthcare industries are focusing more on services such as primary care and mental health care, as it is two of very important factors moving forward, especially in today's society. One thing that is very important is that each business has different products. It's very important for competition, as it allows the consumer to pick and choose what they want and what services they want for their healthcare. But unfortunately, from the research we've done, companies are very similar still to this day in the healthcare industry, because it is a very niche and very specialized field. Ultimate consumers' wants and needs. A recent study conducted by CVS Health found that 81% of U.S. consumers believe that it is important for their primary care provider to be aware of their overall happiness and life satisfaction levels. Convenience is also becoming a very important factor, as people are turning to more digitized healthcare than face-to-face. They're looking for more online checkups and mobile apps that can seamlessly digitize their healthcare, as instead of going to the office, which could have arisen from the pandemic, as more and more people were staying inside and not going to their doctor. Now that the restrictions have been lifted, people liked the changes that were made and don't really want to go back.